Epilepsy. It's a neurological disease. Look at this picture, shows that EEG, electroencephalogram findings, CT and MRI findings, detail going on. Introduction. Epilepsy is a neurological disorder characterized by recurrent unprovoked seizures. A seizure is a sudden surge of electrical activity in the brain that affects how a person feels or acts for a short time. Definition. Epilepsy is defined as having two or more unprovoked seizures occurring at least 24 hours apart. It can affect people of all ages and has various manifestations. Types. 1. Focal seizures, classified into A. Simple focal seizures affect a small part of brain, may cause itching or changes in sensation. B. Complex focal seizures can make a person confused. C. Secondary generalized seizures begin in one part of brain and spread to both sides. Two. Generalized seizures, classified into A. Absence seizures, brief lapse in awareness. B. Tonic clonic seizures, loss of consciousness and convulsions. C. Atonic seizures, sudden loss of muscle tone. D. Myoclonic seizures, sudden, brief jerks of muscles. Three. Unknown onset seizures, seizures where the beginning is not known. Causes. 1. Genetic predisposition. 2. Brain injury, trauma, stroke, previous infections. 3. Developmental disorders such as autism. 4. Metabolic imbalances. 5. Infections, meningitis, encephalitis. Risk factors. 1. Family history of epilepsy. 2. Head injuries. 3. Brain infections. 4. Stroke and other vascular diseases. 5. Brain tumors. 6. Degenerative disorders such as Alzheimer's disease. 7. Prenatal injury or developmental disorders. Complications. 1. Injuries from seizures, falls, accidents. 2. Drowning, if a seizure occurs in water. 3. Emotional health issues, anxiety, depression. 4. Sudden, unexpected death in epilepsy. 5. Cognitive impairment. Pathophysiology. Epilepsy is believed to result from an imbalance between excitatory and inhibitory neurotransmitters in the brain. This imbalance leads to abnormal electrical activity that manifests as seizures. Various structural, genetic, and functional abnormalities contribute to this imbalance. Signs and symptoms. 1. Temporary confusion. 2. Staring spells. 3. Uncontrollable jerking movements of the arms and legs. 4. Loss of consciousness or awareness. 5. Psychic symptoms, fear, anxiety. Diagnosis. 1. Medical history, detailed description of diseases. 2. Neurological examination, assessing motor abilities, behavior, and intellectual capacity. 3. EEG, electroencephalogram, detects abnormalities in brain electrical activity. 4. Imaging test, MRI or CT scan to look for structural abnormalities in the brain. 5. Blood test, check for infections, genetic conditions, or metabolic issues. Nursing diagnosis. 1. Risk for injury related to seizures activity. 2. Ineffective coping related to the chronic condition. 3. Knowledge deficit related to epilepsy and its management. 4. Anxiety related to the unpredictability of seizures. Management. 1. Safety measures, padding, sharp edges, supervising during activities. 2. Education, teaching patients and families about seizures management, medication adherence, and lifestyle modifications. 3. Monitoring, keeping seizures diary, recognizing triggers. Treatment. 1. Medications, anti-epileptic drugs, AEDs to control seizures. 2. Surgery for patients who do not respond to medications. 3. Vagus nerve stimulation, VNS, a device implanted to reduce seizures. 4. Ketogenic diet, high fat, low carbohydrate diet for certain patients. 5. Responsive neurostimulation, a device that monitors brain activity and delivers electrical stimulation to stop seizures. Psychosocial medicine. 1. Support groups, providing emotional support and sharing experiences. 2. Counseling, addressing mental health issues like anxiety and depression. 3. Education, promoting understanding and reducing stigma in the community. Prevention. 1. Head injury prevention using helmets and seat belts. 2. Parental care, proper nutrition, avoiding alcohol and drugs during pregnancy. 3. Managing risk factors, controlling blood pressure, preventing infections. In conclusion, epilepsy is a complex neurological disorder with significant impacts on individuals' lives. Understanding its types, causes, risk factors, and treatment options is crucial for effective management. Comprehensive care involves medical treatment, lifestyle adjustments, and psychosocial support to enhance the quality of life for those affected by epilepsy. Thank you. Have a nice day.